Standing in the sterile hospital corridor at 2 a.m., my hands trembling from exhaustion, I stared at the brain scans of a 19-year-old car accident victim. 20 years earlier, I had been a girl from Kherson, Ukraine who dreamed of becoming a doctor while helping my grandmother sort herbs in our tiny garden. Now I was making life-or-death decisions in one of Boston's top hospitals. "Doctor Viktoria, we need a decision now," the resident urged. I took a deep breath, steadied my hands, and pointed to the scan. "We operate immediately. Call the team." That night, we saved that boy's life. But my journey to that moment cost me everything I knew and loved, and gave me a purpose bigger than I ever imagined. I grew up in Kherson, a small town in southern Ukraine, where the Dnieper River meets the Black Sea. Our apartment was barely 600 square feet, home to my parents, grandmother, younger brother, and me. My father worked at the shipyard, and my mother taught chemistry at the local school. "Viktoria, come help me with these," my grandmother would call, spreading medicinal herbs on newspaper across our kitchen table. The scent of chamomile, mint, and valerian filled our tiny kitchen as she taught me their healing properties. "These plants heal better than fancy medicine," she'd say, her weathered hands sorting the dried leaves. But imagine what you could do with real medical knowledge. I was 7 when I announced I would become a doctor. My parents exchanged worried glances. They knew what an impossible dream this seemed for a family of our means. The Soviet Union collapsed when I was 12. What followed was economic chaos. My father lost his job when the shipyard closed. My mother's teacher's salary went unpaid for months. I watched my parents age years and months, selling family heirlooms to buy bread and potatoes. Still, I studied. Our apartment had no heat that winter, and I read biology textbooks by candlelight, wearing 3 sweaters and fingerless gloves my grandmother knitted. My grades were perfect. "You think books will feed this family?" my father shouted one night, the stress breaking through his usual quiet demeanor. "We need you to work, not dream." The next day, I got a job at the local market, selling vegetables after school. I was 15. For the next 2 years, I worked at the market, studied until midnight, and helped my mother cook and clean. My eyes burned from exhaustion most days, but I graduated at the top of my class. The day my acceptance letter to Kyiv Medical University arrived, my parents couldn't hide their pride, or their fear. The scholarship covered tuition, but nothing else. We calculated the costs: housing, food, books, transportation. The total was more than my parents earned in 6 months. "I'll find work in Kyiv," I promised. My grandmother pulled me aside that night. She pressed a small fabric pouch into my hand. Inside was $220, her entire life savings. "For the beginning," she whispered. "The rest is up to you." In Kyiv, I shared a tiny dormitory room with 3 other students. I found work cleaning houses during the day and waitressing at night. I slept 4 hours on good nights, studied on the subway between jobs, and lost 15 pounds that first semester. The medical program was brutal. From 120 students who started, only 82 would graduate. The professors showed no mercy. "Medicine is not for the weak," my anatomy professor declared, looking straight at me when I nearly fainted during our first cadaver lab after working a double shift. "Perhaps some of you should reconsider your choices." His words burned. That night, I cried myself to sleep, wondering if my father had been right. Maybe dreams were luxuries poor Ukrainian girls couldn't afford. But the next morning, I got up at 5 a.m., reviewed my anatomy notes while brewing tea, and vowed to prove him wrong. During my 4th year, an American neurologist gave a guest lecture on advanced stroke treatment. Dr. Marshall from Boston Medical Center stayed afterward to answer questions. I waited until everyone left before approaching him with shaking hands. "Your research on neural regeneration after stroke, it's brilliant," I said in my careful English. "I have ideas about applying your methodology to traumatic brain injuries." He looked surprised, then interested as I explained my thoughts. We talked for an hour. Before leaving, He handed me his card. "Apply to our international residency program," he said. "We need minds like yours." That night, a new impossible dream took shape. The application process was daunting: USMLE exams, recommendation letters, visa paperwork. I studied English 5 hours daily while finishing medical school. My test scores were exceptional, but the application fee of $150 might as well have been $15,000. I took extra cleaning jobs, tutored rich kids in biology, and skipped meals. When I finally submitted my application, I weighed 103 pounds and hadn't called home in weeks because I couldn't bear to hear the worry in my mother's voice. The acceptance email came on a snowy March morning. Full scholarship to Boston Medical Center's neurology residency program. I screamed so loudly my roommates thought I'd been injured. My family sold their car to buy my one-way ticket to America. My grandmother couldn't come to the airport, her health had declined, but she pressed a new pouch into my hand the night before I left. "For the new beginning," she said, her eyes cloudy with cataracts. Inside was her wedding ring. I left Ukraine with 2 suitcases, $340, and a promise to make it all worth it. Boston bewildered me. The wealth, the speed, the size of everything, from coffee cups to highways. My tiny apartment in Dorchester cost $950 a month, almost my entire stipend. I slept on a mattress on the floor and owned a single pot to cook in. The residency nearly broke me. My accent made communication difficult. Nurses sometimes ignored my orders. Patients requested a real American doctor. My supervising physician criticized everything from my handwriting to how I introduced myself. The medical knowledge gap wasn't wide, but the cultural one seemed unbridgeable. American patients expected doctors to be both authoritative and friendly, a balance I struggled to strike. 4 months in, I made a medication dosage error. The patient wasn't harmed, but my supervisor berated me in front of the entire team. "Maybe medicine works differently in Ukraine, doctor. Boyko, but here we don't guess." That night I called my mother for the first time in weeks, sobbing so hard she couldn't understand me. When I finally caught my breath, she asked one question: "Are you coming home?" The silence stretched between us, 5,000 miles of hope and sacrifice. "No," I finally answered. "Not yet." The turning point came 6 months later. A Ukrainian family rushed into the ER with their grandmother, a stroke victim. The panic in their eyes, their broken English, I recognized myself in them. I spoke to them in Ukrainian, explaining the procedures, the prognosis, the options. The relief on their faces as medical terminology became understandable transformed something in me. That night, their grandmother stabilized. The family hugged me, calling me an angel. My supervisor witnessed the entire interaction. "I didn't know you could do that," she said quietly. "There's a lot you don't know about me," I replied. I began volunteering at a free clinic in East Boston, where immigrants without insurance came for help. I saw Salvadoran construction workers, Brazilian house cleaners, Russian elderly, people working impossible hours for minimum wage, people afraid to seek medical help until conditions became severe. I recognized their stories. They were my story. During my 3rd year of residency, I started a neurology outreach program, monthly screenings for stroke risk factors in immigrant communities. We found dangerous hypertension, undiagnosed diabetes, ignored symptoms. "You need to see a doctor," I'd tell them. "We can't afford it," they'd answer. "I am a doctor," I'd say, "and we'll figure something out." My grandmother died during my final year of residency. I couldn't afford to fly home for the funeral. I took her wedding ring from its hiding place in my apartment and wore it to work that day, completing rounds with tears blurring my vision. A patient, an elderly Russian woman with Parkinson's, noticed my red eyes and took my hand. "You are far from home," she said in Russian. "But you are not alone." 10 years have passed since I arrived in Boston. I'm now the chief of stroke neurology at Boston Medical Center and run the Immigrant Neurological Health Initiative. We've screened over 15,000 patients and connected thousands to affordable care. Last year, I testified before Congress about healthcare access disparities in immigrant communities. I cited statistics: 40% of immigrants delay seeking medical care due to cost concerns. Immigrant stroke patients arrive at hospitals an average of 3.5 hours later than non-immigrants. Untreated hypertension rates in immigrant communities reach 38% compared to 26% in the general population. But I also told stories. The Ukrainian grandmother saved because her family knew stroke symptoms. The Haitian man whose early detected brain tumor was removed before it became inoperable. The Chinese woman whose seizure disorder is now controlled with medication subsidized through our program. My center now employs doctors, nurses, and staff from 17 countries. We've created simplified neurological education materials in 24 languages. When patients arrive frightened and confused, they often find someone who speaks their language, understands their fears. I bought my parents a new apartment in Kherson 5 years ago. They've visited me twice. My father, who once doubted my dreams, now introduces himself to everyone as the father of the famous doctor. I keep my grandmother's herbs growing on my apartment balcony. Sometimes I still sort them by moonlight, the scents transporting me back to our kitchen in Kherson. The journey from Kherson to Boston transformed me. The girl who once sold vegetables now performs complex brain surgeries. The student who nearly fainted in anatomy lab now trains the next generation of neurologists. I still work too much. I still worry about money sometimes, medical school loans, helping family back home, the non-profit programs we run. I still feel like an outsider in certain rooms. But when a frightened patient grips my hand and asks, "Will I be okay, doctor?" I know exactly why I'm here. If you're reading this and wondering if your dreams are too big, if the barriers seem too high, if the sacrifice seems too great, I won't tell you it's easy. It's not. You will cry. You will doubt. You will want to give up. But that impossible dream might be waiting for you on the other side of fear. That skill you have, that perspective you bring, the world needs it. Someone, somewhere, is waiting for exactly what only you can offer. My grandmother used to say, medicine heals the body, but purpose heals the soul. Find your purpose. It might be oceans away from where you started. But the journey, hard as it is, might be exactly where you're meant to go.